When I think back on all the fears when I was pregnant, all of them dismissed except for one. The only test the state mandated was genetic. Looking for that extra chromosome.
Hello and welcome to the If We Knew Then podcast. I'm Steven Sachs,
And I'm Lori Sachs.
and today we have Dr. Jill Lasky from the Lasky Pediatric Dental Group.
This is our second visit with Dr. Jill. I always love talking to her because dentistry and dental health can be overwhelming for many reasons, and she just has a way of putting you at ease and giving you approaches that are accessible and realistic, and that has been such a useful tool for both of our kids, for both Liam and Sophia.
And she's a mom. You know, she has two boys. I think it probably stems from that she understands the reality of a household and trying to get kids to brush, floss, and maintain their dental health.
And if it's not something we can do as parents, then we're not going to do it, right?
Oh, totally.
And in this episode in particular, she gives us tips to share with you on how to tackle those, what can be overwhelming, nighttime routines.
Her practice is in Studio City, California. So if you're living in the Southern California area,
She is definitely worth the drive. She had an office that was a little further before when we were looking for a dentist for our kids. And I have to tell you, Liam is not the one who had dental problems. Sophia had a lot of dental challenges, and it's worth the drive to have somebody who is going to be patient and caring and kind and loving, if you will. For a dentist to be loving, I think that is a very unique combination, but she's the most loving and kind dentist that gets the job done and does an amazing job that I have ever happened upon.
and it's a family affair. Her husband, Michael, is the other doctor in the practice.
Right. And I think maybe that's it. Maybe it's about family. So from our family to yours, in this month of gratitude, let us share with you someone we are profoundly grateful to know, Dr. Jill Lasky.
Dr. Jill, thank you so much for joining us again on the podcast.
Well, thank you for having me.
It's our pleasure because you have been such a gift in our lives and our learning about how to approach the dentist, that we're so fortunate to be able to share that with everybody else.
Obviously, many people may have concerns about going to an appointment during the pandemic, especially if they may feel a checkup is not totally necessary. What safety valves have you had to build in your practice, and what physical changes have you made in the office to stay safe and help ease concerns of your patients?
Ourselves, we have a face mask, so that looks different. I clip mine on my glasses, so it's not that invasive looking. We have double masks. The hygienists wear a yellow gown. I do, depending on what procedure I'm doing. But the waiting room is different, and no toys. And the toy box is now like candy jars. I filled up toys, and you tell the front desk what you want. We're not really having as many parents in the back anymore. I mean, we can still have them in the private rooms, but in that open area, really, if the kids can have a hygienist clean them, we're having the parents stay the front. And there's like these shower curtain devices between the chairs, and then we spray the rooms after everyone gets up with a non-toxic disinfectant that kind of cleans the air, and then with HEPA filters around, and these sneeze guards on the front desk, hand sanitizers, and the waiting room's kind of rearranged. I mean, it still looks homey. It was very important that I keep it that way, and the aesthetics are really clean still. People are adapting.
I know staying open for your patients is important, and you want to make the office a safe place for them and your staff and yourself, but you still want to keep the place warm. You want this office to be inviting, a comfortable place, a calming place. I know you have high standards for safety, so what kind of guidance did you have for all these changes?
Well, there's tons and tons of webinars. That's what we did, especially the last 2 to 3 weeks before we opened. I, there's not necessarily like a number, but of people you have to be in the space, which we definitely cut down the volume, and just we've kind of adapted. There are guidelines the American Dental Association put out, like your returning to work guidelines, and the CDA had some. So we just kind of like use the different guidelines. Like you take your temperature, there's questions you've asked before. My staff have to have their temperature taken every day. I mean, it's a combination of what Michael and I have studied, what we thought we could adapt to our space, what's applicable to our space. The hard guidelines is we can't do all dentistry yet because we're really not supposed to use the drilling handpiece yet, unless it's a emergency. So we've modified what procedures we can do. That's probably the most strict guidelines. But they've evolved. When we first opened, you could do things, now we can't. Now we can do some more things again. It's always evolving. So patience has been the key thing that we've had to learn, for sure. Patience and being very open, and having our whole team be open. That's been another interesting aspect to this, trying to make sure everybody feels comfortable. It's really important to me that the staff feels comfortable before we can invite anyone to our home. So we did dry runs. We had individual, like by front desk team and the hygienist team and the assistants team, we had stuff done, with all the prep work.
Yes, well, patience is the key, especially as we learn more and more as how to implement these protocols.
Exactly. It's everyone is learning how to evolve. Everyone's learning how what maybe worked today, and then, oh, guess what? Now we're changing, and it's taking that parenting skills to a next level and trying to actually remind a bunch of 20, 30, 40, year old men and women that we still have to change what worked, 2 months ago isn't working now. It's definitely learning for everybody.
One thing about dentistry that maybe not everyone is aware of is just how important the health of your teeth and your gums are to your overall health. We discussed in our last interview with you some issues and non-issues when it comes to tooth decay in children with Down syndrome. But what can't be overlooked is the correlation of gum health to overall inflammation of the body.
Right. And we're finding, with more and more, the more that we understand about, like it used to be, you have a cavity, you eat candy, you don't brush your teeth. And it's so not true. And that's, I mean, yes, more people are more prone because of the bacteria levels in their mouth. So some people have to work harder to make sure that if they have the, less than ideal chemistry, they're more at risk for decay. And that, that's why when I said about, kids with Down syndrome, typically they fall on the lower risk for cavities, but their gum health is important to make sure they can masticate and chew properly and make sure that their, tongue is still in the best condition it can be. And all those other things is important to make sure that they're also careful, because another thing that's very common is they have missing teeth. Besides the teeth being smaller, they don't always have the full dentition. They don't have a full amount of adult replacements for all their baby teeth. So a lot of times there might be kids with Down syndrome or young adults or older adults that still have baby teeth in their mouth. So you need to make sure that they don't get a second chance on that tooth, that it is as healthy as possible. So the gum and the periodontium that is holding it, the gum and bone that's holding those baby teeth in their mouth, is so critical because there's no replacement for that. So they need to have it when they're, in their adult life, in their 40s and 50s plus.
Which brings about a topic that everybody loves, and that's flossing. Would you talk about flossing? I know Steven's just discovered the water pick. Do those go hand in hand, flossing and water pick?
Yeah, the latest research shows that if you use a water pick, I only can speak for the water pick brand. There are ADA studies, American Dental Association studies, that is equivalent to flossing. And a water pick is definitely more user friendly than flossing, although there are different flossing tools, like this thing called Gum Chucks that has a two-handed model that's easier to floss properly. But the water pick is an absolute amazing tool. They have ones now that even can go in the shower. So you don't necessarily need to floss or do that kind of gum care, floss or water pick in conjunction with brushing. So if you're bathing once a day, you can have the water pick in your shower or bathtub. And especially since it's on the messier side and you're in a water environment, doesn't matter as much. And you can, use your water pick when you're bathing, and then that's the one time a day you can brush your teeth before or after. So it's a great adjunct, and it definitely, you don't need the same dexterity. And it feels good to have the kind of like that, pressure washer on your gums. So it's a great tool. Water pick or flossing is imperative to keeping your gums healthy.
Well, I can tell you, probably no matter how healthy your gums are, you can brush your teeth and rinse your mouth, and then you get a water pick in there, and it only has to happen every once in a while. You'll go, wait, how did that just come out?
Yeah, because of I'm going to get into the boring, but it's the amount of the angle and the pulsing that it'll get things up in the sulcus, which is the kind of like the neck between the tooth and the gum, and the water can kick things up that were down there deeper, that our toothbrush bristles can't sweep down there. And flossing only goes between the teeth. It doesn't go like on the flat part, the direct part of your tooth. So yeah, the water pick's great.
You mentioned the pulsing. For me, I don't use the pulsing just because I don't know if it's doing as much. It doesn't feel like it's as strong, but you were just mentioning it. Does it sometimes maneuver things better?
Well, it does. It even just the way it squirts out, but it's just even if he's on a regular mode, it still has like a pulsing that you're not aware of. That it does. It's just how it's manufactured. That's why I know that the Waterpik brand has that, and that's what the studies are correlated with versus some other brands. I don't know if they have that same capacity. It's fine to use on the standard mode as well.
In regards to the Waterpik, do you have any suggestions or approaches for somebody who has Down syndrome? Like how would I approach, like for Liam, what advice would you give me if I wanted to start him on a Waterpik?
So the best thing to do for all dental care when you're trying to do it on somebody else is to go from behind. So in front, even if it's, a parent, a loving caregiver, right? You're going to be more, something's coming at you, right? So our animal instinct is to dodge it, right? So if you're from behind and the child puts their head up to looking at the ceiling, then they're looking eyes to eyes and you can see the person, and then you have more control of their head. So that's the first thing I would do. So for brushing, that's the technique I recommend. And for using any kind of water pick, or if you want to floss your child, so have them you stand behind them, they put their head up, and then you are able to brush or use a water pick. If you want them to model or want them to try to do it independently, the one that I refer to that can go into the shower is portable. It's wireless. So they can use it with one or two hands, depending on, their grasp and their dexterity level, and just have them close their lips. I would first show them with it off and show them kind of put it at the gum line. And then to put it on, you have to pierce your lips so it doesn't go everywhere. But just kind of, I would mimic it by guiding them with their hand on the machine, on the apparatus, with you. And then eventually they'll be able to let your hand go, just like you would with a training wheel or a bike or anything else. You kind of have to guide them through, and then eventually they'll feel comfortable and you let go and you let them, go at it. But coming from behind is key.
So toothbrush, obviously, the main tool to use. If you can, try to get your kids to floss. You had mentioned gum chucks. That might help with flossing, make it a little easier, with the handles and stuff. And I know Sophia uses those. She really likes the gum chucks. Also, a water pick, which is a very effective option. Feels good in your mouth. Some kids might really like that. Are there any other tools that you recommend that parents can introduce to their children to help them maintain oral health?
Yeah. I've had parents have success with like the double-headed toothbrushes, especially if their child really likes to gnaw and chew. If that's kind of like whenever there's something in their mouth, they tend to chew on it. There's ones that have like bristles on both sides. A lot of parents like that. There's ones where it's like two hands. It's almost like a two-handed cup. I would definitely kind of do a search on the internet, and you kind of just have to buy a few and see what works best. But the bottom line, whatever I say, some kids like the electric toothbrushes. They like that vibration, that stimulation is good for them. They like that vibration on their gums with or without teeth. But it's consistency. I would pick a time of day. I would definitely not do it right before you go to bed. Parents say to me that a lot of times, like, you've had enough. I think that brushing after you eat and before you go to bed is critical, because while you sleep, everything sits. They're not moving their tongue around. They're not talking. And that's when the damage kind of happens. So it's key to have a PM brush. But sometimes it's best to take care of that in the kitchen or right after you're finished eating. And not doing it like maybe after bath when things are already kind of quieted down, because a lot of times I can get the kids riled up again, or everyone's kind of had a day and they're done and they need whatever bedtime hour is to not come soon enough, sometimes. So I'm a realistic person. So I would kind of pick an earlier in the evening and just do it every single day, no matter what. I wouldn't skip. Unless your child's like in the car and they fall asleep and you transfer them into their crib. But anything shy of that, even if it's for 10 seconds, you need that consistency, because for everybody, that routine is key. It might be a different toothbrush tonight. It might be without toothpaste because you don't want to have that fight tonight, but it needs to be some attention to the mouth. So that's what I'd recommend.
And whatever you can get in there, if you
whatever you can get. I mean, the 2 minutes twice a day is, I don't know, that's not in my parenting world. In my house, that is still struggle with 17 and 14-year-old boys. So it's, you need to at least kind of get, my goal is 5 seconds every evening, I think is then anything above that, you're cheering yourself and you're patting yourself on the back. I mean, it's maybe not going to write that in a textbook on, how to care for teeth, but that's kind of like the realistic parent approach that I think that I need to make sure that parents know it's okay. It's okay that if that's all you did tonight, it's okay.
Again, this is why we love you.
Yes. Just the ease you give, because, you as a parent know the pressures that we all have. And if you're a parent of a child with a disability, you could have a little more pressure involved. I mean, we feel that way, but some people may not. But to us, there's just this overwhelming pressure chamber that's just kind of ready to go off, just kind of more there. And if we can just feel, hey, even if it's no toothpaste, just can I get a toothbrush in my kid's mouth? Doing that and getting that in there and just making a routine. And then can we just move on?
Yes. I know you a lot of times you're like, I want my kids, I want to, or they should be doing what, next door is doing, what my friend's doing. We fight as parents to not compare, right? Look at my child for who they are. Look at my child for who they are. But sometimes you worry, is this what it's supposed to be? And everybody does that. But if you can just stay centered and just feel like I'm doing what I know is best for what my individual child right now, and I'm doing the best they can. And this is what our reality is, in this quarantine. And we were discussing before, what is this going to mean for our kids for not having these milestones met, for these, life events that are happening in a virtual world, or not having this experience with other, peers. We just have to sit back for a minute and be like, well, the child that's going through it has nothing else to compare it to. So let's just make it the best experience we can, and not try to feel pressured and rushed and feel like we have to look next to us and behind us and around us, and just be present with what you have right there and be grateful for what we have.
Just even hearing your conversation and the pressure, that we have with, brushing Liam's teeth and making it into a habit. And we've had relatively good success because I think we've had these conversations with you, and Liam has made it into a habit, and he is very proud at this. It was struggle, but now he'll do it on his own, and he loves it because he feels so independent, and he wants to come out and show us his teeth and have us smell his breath. So, but it's that level of ease that your words can really give. It gave me the freedom to be there, and sometimes we need that permission, because we're always trying to, I think any parent, any mother, any father, any guardian is always trying to do it right, and we're all doing our best. But sometimes that I'm trying to do it right can make this subtle shift into just this insurmountable pressure we put on ourselves. And it does take someone from the outside to give us the permission to not seek this perfection that we continually seek, that inevitably falls with a hard hammer of reality.
Always, I know. And the other thing is, I have parents that come and, my son sucked his pacifier till he was almost 6 years old. His mom, dad, and grandfather are pediatric dentists. That is what, David needed. I'm not supposed to do it. What are you doing? You're messing up his teeth. All the things. I'm like, okay. But that, I had to look at him different than his brother. And I have parents, I have other people say, you have to do this and you have to do that. I'm thinking, who's the have to person? All we have to do is love our kids and provide, the safest home possible, and, hopefully food on their table, and give them a sense of security, because where they feel safe, then they can thrive and grow and be as independent as they can. So that's, I don't know, the have to stuff bothers me. It can be very weighing, and it sounds like you're doing good to have like guidelines, but sometimes I think it backfires, and then you fall as a parent, and then that can spiral to something else that isn't going to be helpful for anybody, yourself, your relationship, anyone at all.
Well, that really is a great segue into what we like to ask guests a lot of times, is an if we knew then statement. Usually has something to do with Down syndrome. I was trying to figure out how to ask you this question of something that you wish you knew, years ago. Is there something you wish you knew years ago?
Or last week.
Oh yeah, it could be last week.
Or yesterday.
Something that you wish you knew then, and it could be about your practice, or maybe just as a parent, or maybe specific to Down syndrome.
I think I wish as I'm getting older, I can talk on more of a parent, to trust myself more, I think, and not question, not look around as much. I think that I wish I trusted my own instincts a little bit more, instead of looking for experts all the time to give me permission to parent the way that I thought was right for, my child, and where my boys were at that moment no matter what the, textbook says, where they're supposed to be, what milestone they're supposed to be reaching. If I could just trust my, gut, or my, mommy instinct, and all those kind of things that we're given with, to those internal compasses, or whatever, catchphrase is important now. I think if I just kind of knew to rely on that, I think that's probably, it would have made those first few years a lot easier for me as a parent.
Just having you as our dentist really changed basically my relationship with both of my kids, because one thing that you do that I heard so early on was the way you talked to Sophia and then Liam, and the tone and the words you would use. You would say, okay, love, and just really kind, uplifting words. And you don't make a big deal out of it. It's just your vocabulary. And I started to use those words, and that's how I talk to Sophia. Even if she's done something that's frustrating, I'll still use a kind term of endearment, and it just changes the environment and the relationship. And while you're working in their mouth doing this thing that can be very frightening, and then for me as a parent, you take any situation, and at the foundation of it is care, and that is so important. And it's not something that's like, hey, I really care about you, so I'm going to floss your teeth now. It's just there. And I think that that's what's absorbed, is that, okay, this might be scary, and this might even hurt a little bit, like the shot might hurt a little bit, but there's just this inside thing that they know that they're cared for. And I took it from you, and I use it in the home, because it makes a huge difference on any conversation or situation. So I thank you for that.
Thank you.
Dr. Jill, thank you so much again for being on the podcast. We always love talking to you. We would love to see you, but we love hearing what you have to say. You're so knowledgeable, and we really appreciate all this wonderful information that we're able to share with our listeners.
Thank you. I adore you both and your family, and I just give you big hugs through the phone, and hopefully I'll see you soon whenever the kids are ready at the office.
Please follow us on Twitter at If We Knew Then Pod, and you can drop us a line on our Facebook page at If We Knew Then Pod, or visit our website, ifweknewthen.com, to send us an email with questions and comments. And you can join our mailing list there and get alerts of future podcast episodes. All these links will be added to this episode's show notes. Thank you again, and we look forward to you joining us on the next episode of If We Knew Then.